In this video, we're going to be talking about pneumonia. So when I talk about pneumonia, what pneumonia is it is damage to the lung, typically due to an infection, that results in increased fluid buildup in the lung and just and sputum production and just overall bad state for the lung. And so there's several types of pneumonia, or several causes. There is CAP, community acquired pneumonia, and this is the most common type. This is you're out and about, you're around sick people, and you catch it out in the community. The other example is an HCAP. This is a hospital acquired pneumonia, and so, or healthcare associated pneumonia. And so what this is you're in a hospital, and either you're exposed to pneumonia while you're in the hospital, or you develop pneumonia due to complications in the hospital. And we'll touch about that in just a second. You also have aspiration pneumonia, which is you inhale some food or a liquid into your lungs, and then the bacteria grow off of that while it's in your lungs, and you develop pneumonia due to aspiration. And then there's ventilator associated pneumonia, which is another type of healthcare associated pneumonia, in which you have a ventilator and you develop complications from the ventilator that lead to your pneumonia. So some risk factors: exposure, being around sick people, the age, very young or very old, smoking, not having a pneumonia vaccine, having chronic lung disease such as COPD. You can't cough out the gunk, so it's just going to stay in your lungs. Aspiration, or having dysphagia such as an elderly or after a stroke. Immobility, you're stuck in bed, you're in a hospital sick for another reason, and you're not moving around, and you're not coughing and getting those fluids up and moving out of your lungs. Having a ventilator, or having a poor cough. Say you had thoracic surgery, abdominal surgery, and it hurts too much to cough, and you can't get the gunk out of your lungs. So signs and symptoms of pneumonia. You're going to have a cough, and you're going to be having some sputum production. You're going to have, your lungs aren't working as effectively as they should, so you may see a drop in the oxygen levels. You're going to have a fever, possibly with chills, and because you're fighting an infection. And so you may have dehydration because you're breathing more, you're coughing and spitting stuff up, and then you're naturally hotter with the fever, and you may be having sweats. So it's often that you'll get dehydration. You're going to have weakness and fatigue just because your body is sick. And you can hear sometimes crackles and wheezing and nasty sounds in the lungs from those fluids and the sputum. So some labs that you can do to diagnose pneumonia, well, you'll look at all the symptoms, and you'll see a sputum culture, and you'll want to get that before you start antibiotics. And what they'll do is they'll just test and see what kind of bacteria is in there. Now, it's going to take several days to get that back, so they'll probably get a sputum culture and then start you on some antibiotics. In the meantime, if they end up needing to change the antibiotics later on to one that's better for that particular bacteria, they will. But they'll go ahead and just get a sputum real early. You'll see elevated white blood cell count because you're fighting an infection. And they typically draw blood culture at this time because there's a lot of small blood vessels in the lungs, and so that puts you at risk for getting some of your infection into your blood. And so it's very common to get sepsis, or a bloodborne infection, from pneumonia. They also can do a chest x-ray, and they'll see a very dense lung with lots of fluid and buildup. Treatment. So what they want to do is they're going to start antibiotics if it's a bacterial pneumonia. If it's viral, then they're going to do everything else. So oxygen therapy if necessary to make sure the patient's O2 levels stay up well enough. Respiratory medications to help the lungs work better. Bronchodilators to help open up the airways and such. Mucolytics such as Mucinex to help cough up any gunk that's stuck in the lungs. IV hydration and encouraging PO hydration so the patient doesn't become dehydrated, or to correct their dehydration. Incentive spirometer, this is going to help with teaching the patient to cough, and also teaching them to take deep breaths to really open up those lungs. And if a patient isn't moving, getting them mobile, ambulating is going to help open up those lungs as well. And as always, smoking cessation. If the patient's smoking, it's not doing them any good. Now, if it is a bacterial pneumonia, you want to be sure the patient takes their antibiotics for the full length of the prescribed treatment, because if they only take it until they feel better, they still may have pneumonia in them that is going to grow, and they may have to come back with pneumonia again. Anyways, this is pneumonia.